Hello, good morning, Gerald.
Good morning, sir. How are you today?
Oh, very well. I see you.
Yeah, this is an external fixator that we
Yes.
do today.
Yes.
It's just a wrist, so we just laying up, making sure everything is all ready as we need it before we go in. Yeah.
Fantastic.
Theater, and we're good to go.
Fantastic. What is your major concern for this procedure?
My major concern is compartmental syndrome when we have to put all this metalwork in. So we need to check that in neurovascular as well. We need to check that, especially in the recovery, post operative side. So we need to make sure when we hand over to the recovery team, they need to check neurovascular, and they also need to check bleeding and compartmental syndrome especially.
Are you concerned about your patients for any specific condition according to their past medical history?
Yeah, the only issue that we're worried about is they've got a cast at the moment and they had a plate inside which has failed. So we are actually concerned about infection as well. So, they need antibiotics, pre-op, post-op as well. They're going to need antibiotics. We're going to be very, very careful, not to introduce infection today, and also hand over to our other teams to make sure we keep an eye on, on their observations really, because, they could spike a temperature because we're worried we're going back in where somebody else has been already, so we're worried about infection as well.
Well done so far. Gerald, can I ask you something else, please? Did you check your patient before you lay up your tables in the anesthetic room about the glycemic status, any allergies, the identity of your patient?
Yes, we go in there and we check everything. So we've got what we call the WHO checklist, the World Health Organization checklist. It's good because it's pretty international. Even my colleagues in America that we deal with a lot, I was with them about 3 weeks ago. They do exactly the same. They check, the WHO, you check the name of the patient, you confirm everything, and you actually see your patient as well before they are put to sleep. You confirm everything with them. You make sure you've got everything that you need for this patient before they come in. So we check to make sure they're not diabetic. If they're diabetic, we need to talk to the anesthetic team to make sure we've got that, glycemic control. We also check what we call the VTE, make sure that they've got 10 stockings and everything done. Yeah, we also check about their cardiac as well, make sure everything is up to scratch. And my sister has just gone to confirm again. So we've got an open wound. So instead of using the alcoholic orthopedic cleaning betadine, we are going to be using the aqueous one, which you can safely use around open wounds. It won't burn.
Which is the side of the intervention?
Sorry, sir?
Which is the side?
We're doing the right side.
The right side.
We also check that with the roof.
On the.
There is a mark as well.
Okay.
You always have to confirm that.
On the arm.
Operating side, yeah.
Okay.
So we also check all those, and we also check sometimes. Sometimes people actually forget. Patients wear jewelry, it could be rings or anything like that. So when you are doing all these checks, we are also very concerned about rings, because you can imagine we're gonna be cutting and doing all sorts of things. There is a chance that they could swell. So if they're wearing rings, usually we talk to our patients and we tell them we're gonna secure their rings. So we actually have to remove their rings. So yeah, we take up their rings and we secure them and make sure everything is
So
okay.
did you say, Gerald, that it's an open wound?
It is an open wound.
So did you prepare the prep stuff for the open wound?
Uh-huh.
So what exactly did you prepare for the open wound?
So for the open wound, so usually you see we've got 2 bowls there. Usually there will be alcoholic betadine here and spirits in there, chlorhexidine. So what usually happens, those are, they're caustic. But today we are just using Vedine betadine. So Vedine betadine in our 2 pots, it's aqueous, so it can be used on an open wound safely. Yeah.
So this betadine is not alcoholic, is that correct?
It's not alcoholic, it's
Correct.
aqueous betadine. Yeah,
Okay.
correct, yeah.
Gerald, thank you very much indeed for your contribution in our research
Thank you, Manus.
in perioperative care. Thank you very much.